Well, welcome back, everyone. I'm Pat Camillo, the creator and presenter for this program. The next section I'm going to be sharing with you is called Cognition and Estrogen, because that'll be our focus. There's three main areas that I'd like to address in this section. The first is brain fog and estrogen. You've all heard about this. You've all maybe experienced it at some point. And the second being the relationship between estrogen and Alzheimer's disease. And there's a lot of interesting work being done in that area. Again, you may have heard of some of this, but I'll try and give you a good update. And then finally, the relationship between estrogen and Parkinson's disease. Now, this is something you may not have heard much about, but it's really interesting. So stay tuned. All right, let's get started. So, brain fog. Did you ever notice that when you're anxious, you have a difficult time thinking straight? It's really not that surprising. Anxiety and our ability to think clearly often walk side by side. And if you recall from the section on anxiety and estrogen, you'll remember how closely connected these two things are. So some women experience this in the late premenopausal phase of the menstrual or the late premenstrual phase of the menstrual cycle when estrogen levels dip down. So you may have experienced it then. Some women experience it postpartum. Of course, with everything going on, postpartum, it's hard to tell what's causing what, but it's probably for the same reason that estrogen levels are dropping. And I also shared how women taking aromatase inhibitors experience something similar. At this point in the program, I'm sure you're beginning to get the idea that estrogen is a very significant hormone in so many regions of the brain. And the experience of a foggy brain is just one more symptom of its impact. In my own life, that's me on the slide, I experienced a time when the drop in my estrogen interfaced with my thinking. So I'd like to share this real-world example with you because it happens. It happens to all of us, and it's very much an organic event. So when I had my ovaries and my uterus removed for endometriosis, I was 43 years old. It dropped my estrogen quickly and dramatically. And of course, endometriosis had always put me in a very high estrogen state. Months before I knew I would have the surgery, I was asked by the Wisconsin Nurse Practitioner Association to do a presentation at their annual meeting. I did one the year before for them, and it was a big hit. However, this time I was just a few weeks out from my surgery. When I started speaking, I noticed I was losing my train of thought, and of course, I became anxious. There was a room full of NPs who were excited to hear me speak, especially after the success of the previous year. But unfortunately, I simply had a difficult time thinking clearly, and this was information that I knew really well. Several people started to walk out of the room, and oh boy, I was devastated. A few weeks later, I realized what had happened. My brain was still adapting to the dramatic change in my estrogen level. Several months later, after starting to use an estrogen patch, I was able to continue to offer successful presentations with no difficulty. So it was clear to me what had happened. My brain was still adapting to that dramatic change in my estrogen level. Over the years following that episode, even when I was no longer using estrogen, I was fine. So my story demonstrates that there is the possibility that changes in your ability to think, especially following a dramatic and sudden decrease in estrogen, may be temporary. The study of women's health across the nation, known as the SWAN study, found that the cognitive changes experienced by women over the menopause transition may indeed be temporary as the body transitions to a new level of estrogen. We see something similar in women receiving chemo, right? They refer to it as chemo brain. Very often it reverses on its own over time since once the chemo is over. So similar thing I think is happening with estrogen. So moving on from something relatively benign like brain fog to something much more serious and a chronic condition, and that would be Alzheimer's disease. This is very much a women's health issue. The evidence for a gender-related difference is clear, since over 2/3 of those affected by Alzheimer's disease are women. And scientists are becoming more and more convinced that estrogen may be playing at least a small part in that connection. And again, it's never going to be the only piece to this disease. Women do, after all, live longer than men, and that alone places them at higher risk. But estrogen does appear to play an important supporting role, and research is continuing to help us learn more about it. One idea, supported by research done on animals, is that estrogen interrupts the development of amyloid deposits in the brain. These are the substances, as you probably know, that are connected to Alzheimer's disease. But it turns out to be a little more complicated in humans. In the Women's Health Initiative memory study, they found that women's cognition was made worse when given estrogen, not better. And yet, in another clinical trial called the Mirage study, there was a benefit. So just the opposite. So what gives? Actually, it's not all that unusual to have very good research studies come to very different conclusions. This is what helps scientists to flush out the details that make the difference. And it seems that happened in this situation. So here's the catch from the Mirage study. The benefit was seen, for women who were between the ages of 50 and 63. There was no benefit after the age of 64. In the WIM study, on the other hand, the women were older, and some believe that they might have already had those plaques in their brain before starting estrogen. And yet, in another study called the Chronos Early Estrogen Prevention Study, or KEEPS, women who enrolled in the study around age 50 showed no negative effect on their memory or their ability to think clearly. Well, and they were younger. So, the picture is a little muddled for sure. And as I often say, it's complicated. And what complicates this even more is that some women need to add progesterone if they have a uterus, right? That particular hormone, though, as I discussed in the previous section, has its own set of issues that might complicate our understanding of the effect estrogen is having on women's cognition. Progesterone can actually impair memory and does a few other things you don't want. And that includes even natural progesterone. There's really only one synthetic form of progestin that's been found to help improve memory, and that's levonorgestrel. But there's a catch even with this progestin. If it's taken along with estradiol, it gets in the way of the positive cognitive effects seen with its fellow hormone estrogen. It appears that taking one could cancel out the positive effects of the other. So, geez. There are some who are now trying to produce a type of estrogen that can be injected directly into the brain to avoid all the possible complications and get right to where it's needed. Now, that's fascinating, but also a long way off. Another interesting tidbit to add here to this section. Tests reveal that women who had undergone menopause or were perimenopausal had markedly lower levels of glucose metabolism in several key regions compared to those women who were premenopausal. So the brain is a real glucose hog. Without it, thinking can get pretty fuzzy and unclear. I personally noticed this quite a bit. I could be sitting at my desk working intently on something, and I seem to want to eat all the time, even though I'm not burning energy with movement. Studies have shown that glucose metabolism in the brain is reduced by almost 25% when estrogen starts to drop off. So that could have some real implications for how you're able to think. Now, it's important to remember that there are other risk factors for getting Alzheimer's disease other than how much estrogen you might have on board. In some studies, scientists have seen a similar pattern of hypometabolism in the brains of patients in the earliest stages of Alzheimer's, and even in mice that model the disease. Poor diet as well as poor sleep, along with lack of exercise, are all risks associated with this disease. And here's another interesting bit of information. Although women are much more likely to have this disease than men in the U.S., it's not the same in other countries. For example, in Australia, the rates are roughly the same. So it makes you want to say, So what's the bottom line? Again, it's complicated. Too often, researchers think about menopause as a disease that can be studied in a lab. And of course, we've learned some interesting things from some of that rat research. But hormonal transitions and hormones in general are quite complicated. And that's because they interact with so many things, with our genes, what we eat, where we live, how we live. When someone has strep throat, we know the cause and we know how to treat it. It's not the same with menopause because, and I want to emphasize this, it's not a disease. So don't be too surprised if you hear more conflicting research as we move forward. There's a lot going on, clearly, that can contribute to the development of Alzheimer's disease. And yes, estrogen is very likely in the mix. And finally, for this section, let's take a look at estrogen and Parkinson's disease. And as I mentioned earlier, you may not have heard very much about this, and it's really interesting. So, different from Alzheimer's disease, Parkinson's is more prevalent in men than in women by about a 3-to-2 ratio. Women are less likely than men to get PD. And why? Well, we think it's because they have estrogen. At the heart of Parkinson's disease pathology are dopaminergic neurons that progressively degenerate over time to cause those symptoms. The picture on your slide shows you that tiny area of the brain where dopamine is produced. Estrogen seems to have a neuroprotective effect against these particular neurons. I spoke earlier about how dopamine is highest when women have enough estrogen on board. The same holds true when looking at the pathology behind Parkinson's disease. When estrogen levels are low, dopaminergic neurons in the brain progressively degenerate over time to cause the symptoms of Parkinson's disease. Now, I had some fun here because I talk so much about research using mice and rats. I thought I should at least give them their own slide, right? But they are doing great work for us, particularly when it comes to estrogen and Parkinson's disease. When estrogen is given to mice, there's a rapid increase in dopamine synthesis. They also observed that dopaminergic activity is highest during estrus in mice following a surge in estrogen. Now, we're not really quite sure how all of this works yet, but it looks like estrogen gets in the way of dopamine recycling. There's another really interesting gender difference when it comes to Parkinson's disease. When women do get PD, it tends to begin more with tremors and depression, whereas men have more rigidity. Progression is also much slower in women. But think about it. If early symptoms in women include depression, and given the increasing rates of depression among women, there's the possibility that this damage is taking place years before a woman even has symptoms of PD. And that's because low estrogen levels are more common in women who are depressed. So I'm afraid we might see an uptick in the incidence of Parkinson's in women in the future. Recent clinical studies have shown the beneficial effect of estrogen treatment on the prognosis for this disease. One study investigated 40 postmenopausal women with Parkinson's, and of these, 20 received 0.6 milligrams of estradiol, and the other 20 received a placebo over an 8-week period. Motor function was significantly improved in the group receiving estrogen compared to the placebo group. And there's more. The connection to estrogen has been confirmed once again by a team at Harvard. They found evidence that estradiol helped to repair some of the damaged areas of the brain seen in Parkinson's disease. Imagine repair. Wow, that's a loaded word. In spite of all this interesting and promising research, though, there hasn't been a rush to use estrogen as treatment in this population. And why? Well, they tend to be older and have other comorbid conditions that could very much make estrogen treatment more precarious. But it's definitely opening up a better understanding of what's happening with PD and providing clues for some new treatments as we move forward. We really need a whole lot more research in this area, but thankfully with the Brain Initiative going on at NIH, I'm hopeful we'll be learning a lot more about all this in the future. So this concludes the section on estrogen and cognition. Since altered cognition is an important symptom in the disease of schizophrenia, I thought it would be helpful to have it follow this section. So that will be the next one coming up, and be prepared because you're going to find a lot of new information in this next section that you're going to find surprising and interesting. So I'll see you in a moment.